Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Now, previously we have discussed about the anterior compartment of the thigh, muscles of the anterior compartment of the thigh, and during our discussion we have seen how the different compartments of the thigh are formed, and here in this slide we can see how the compartments of the thigh they are formed. So here is you can appreciate that here is the anterior compartment of the thigh, and it is separated from the medial compartment of the by this intermuscular septum, which is continuation of the deep fascia, and here is the posterior intermuscular septum, which is separating anterior and posterior compartment, and a fade one, lesser one is another fascia, which is extending from fascia lati, separating the medial and posterior compartment. So here on the medial side we are seeing the medial compartment composing of the muscles, and here near the femur laterally placed are the neurovascular bundle. Here we can see deep femoral artery and vein with the nerves of the medial compartment of the thigh. So before we start detail of the medial compartment and talk about the muscles of the medial compartment of the thigh, if you are sitting on the chair, you can feel the medial compartment of your thigh with your hands, rolling the hand over the medial side of the thigh. And here the muscles Gracilis, Adductor Longus, Adductor Brevis, pubic part of Adductor Magnus. Now, to appreciate these muscles, if you put your left hand over your right knee and try to press the knee inward, medially, adduct it, and strongly, and opposing it with the left hand, you can, with your right hand, you can feel the contraction of the muscles on the medial side of the thigh. So these muscles which are adducting the knee, they are basically four. These are the muscles of the medial compartment, that is Gracilis, Adductor Longus, Adductor Brevis, and pubic part of Adductor Magnus. So we are going to see individually the muscles. Here we are seeing in this slide, here is the Adductor Longus muscle. It's cut one Adductor Longus muscle, and we know that we have seen this muscle while we were studying about the femoral triangle. It was forming the medial boundary of the femoral triangle, while the lateral boundary was formed by the sartorius, which also is shown here in this diagram by the cut edges. Here the sartorius. So adductor longus is a large flat muscles, and it covers the adductors brevis and magnus. So it will originate from the pubic bone and expand into fan shape, attaching broadly linea aspera of the femur. Activity will cause adduction of the thigh. As we know, obturator nerve is a nerve which we will discuss later on, L2 to L4, that is supplying the adductor longus muscle. Here we are seeing another muscle. Here is the muscle that is adductor brevis. Brevis means with the short tendon and heavy body. Inferior, it originates from the inferior ramus. So longus was from the superior ramus, it is from inferior ramus. It is also inserting into the linea aspera, and it is supplied by anterior division of obturator nerve, adduction of the thigh. And if you see its attachment, it will also cause the lateral rotation of the thigh. Adductor brevis. Then is the adductor magnus muscle. Adductor magnus, as the word magnus. Magnus means a big one. So it means is a big adductor muscle. It's a big one. So it is having, because functionally we divide into adductor part, and it lies in the medial compartment of the thigh, so it is called as adductor magnus. Otherwise, this muscle has dual action. It will also adduct the thigh and it will cause the flexion of the knee also. It's two parts. The muscles of the posterior compartment, they are called as hamstring muscles. So we will see when we will study the posterior compartment what are the hamstring muscles are. So one of the part of the hamstring from adductor magnus is here. So here we see this large muscle having attachment here to the linea aspera and here to the condyle of the femur, medial side of the to the adductor tubercle. Here will be the adductor tubercle, and it's originating above from the inferior ramus, as well as you can see here that is extending backward to the ischium. So it has two parts, adductor part from the inferior rami of the pubis. Here will be the adductor part and rami of the ischium attaching to the linea aspera here. Hamstring part from ischial tuberosity. Here is the ischial tuberosity, and adductor. It's the hamstring part. It attaches to the adductor tubercle. Here it is the adductor tubercle, and medial supracondyle line of the femur. So a section will be, it will adduct the thigh, adductor component also flexes the thigh with the hamstring extending the thigh. So these fibers which are upward, they will also cause air attachment, they will also cause some flexion, and this hamstring part will cause the extension of the thigh, So its innervation by adductor part is innervated by obturator, while the hamstring muscle is innervated by the tibial component of sciatic nerve, which is L4N2S3. So we can call this muscle a true hybrid muscle. A true hybrid muscle in the sense that it has two regions, two insertions, two nerve supply, and its action is also two actions. It adducts the thigh and it extends the thigh also. So in this sense, we can say this adductor magnus is a true hybrid muscle. And we know that when we were studying the adductor canal, we know that the inferiorly, when it passes to the popliteal fossa, adductor canal opens into the popliteal fossa on the posterior side of the knee. So we see that the neurovascular passes through a hiatus opening which is in the adductor magnus. So here we can appreciate that this is the opening through which the neurovascular passes to the popliteal fossa from the anterior compartment of the thigh. That's the femoral artery, femoral vein, and the nerve which finishes upward saphenous nerve. It's before entering into the popliteal fossa, it leaves the thigh to become the cutaneous. So mainly the neurovascular that passes and nerves are joined from the posterior side. So the last one muscle of the medial compartment of the thigh is the most superficial one, and on the most medial side here we can see this gracilis, a rope-like muscle. It crosses at both hip and knee joint because it is attached to the tibial condyle. It is originating from the ischium, inferior rami of the pubic and body of originating because it is right thigh, so originating from the body of pubis and the rami of the pubis, almost vertical, and attaches to the medial side of the tibia. So it is crossing posteriorly the knee joint, and it is also anterior to the, supposed to be anterior to the hip joint. So it will cause adduction at hip and flexion at the leg, at the knee. It is also supplied by the obturator nerve. Here we can see the. I hope so that you people must have opened your the atlas or the book with you and look at the muscles in the medial compartment of the thigh. Have a very good look and try to perform the action of the adductors of the medial compartment on your own body while keeping the two knees, trying to oppose each other, the two knees, and trying to separate it and trying to close the knees. Then you can appreciate the adduction of the hip joint. But there are other muscles which are not included in the medial compartment of the thigh, but they are the adductors of the thigh. So, in my opinion, these two muscles should also be discussed briefly here with the medial compartment, because they also cause the adduction of the hip joint, because main action of the medial muscles of the medial compartment of the thigh is the adduction of the thigh. Along with you can appreciate that the other action of the adductor magnus, that is the extension of the thigh, and the other action of the gracilis, that is the, we have seen in the slide, that is the adduction of the thigh and flexion of the leg at the knee joint. So along with, but there are main action is the adduction. So these two muscles, obturator externus and pectineus, they are also adductors. We can appreciate their action by here, seeing that this is the muscle obturator externus. Is coming from the near the acetylum, and it is going laterally to be attached between the intertubercular groove, and so if we see it fibers, when it will act, it will try to pull the femur medially, that is adduction of the thigh. So originate from the membrane of the obturator foramen adjacent bone, passes under the neck of the femur and attaching posterior aspect of greater trochanteric. So action is the adduction and lateral rotation. Obviously it is a rotator of the thigh, but additional action is the adduction, and it is also supplied by the obturator nerve also. So it fulfills the criteria of the medial compartment of the thigh, except that it is not located on the medial compartment of the thigh. The next muscle is the Pectineus One. It's here we can see the pectineus muscle. It is originating from the pectineal line on the interior surface of the pelvis and attaches to the pectineal line on the posterior side of the femur. So just inferior to the lesser trochanteric. So it is passing anterior to the hip joint, and it will cause adduction as well as the flexion of the hip joint. So although it is supplied by the femoral nerve, but also receives a branch from the obturator nerve. So it is also we can say by the nerve supply is a hybrid muscle, this pectineus, but it is also an adductor. So that's why these two muscles also should also be seen and should be discussed with the adductors of the thigh also. So we have seen these muscles. We can appreciate here briefly the obturator externus, adductor magnus, and also the adductor magnus is the adductor part is hamstring part. Obviously these are the cut edges of the adductor longus and adductor brevis. These have been cut to expose the adductor magnus, and here we see that the obturator externus is proximal attachment, distal attachment. Here are the actions of the muscles, and here one thing, that the femoral artery and deep femoral artery and vein passing through the adductor hiatus, that I have shown you previously. Here the adductor hiatus through which the femoral artery and vein, they will pass and they will enter into the posteriorly into the popliteal fossa, and they will become the popliteal artery and popliteal vein. So we have understood about the muscles, and they can be recalled or memorized only when you will see them on the atlas or see them on the diagram in the book. Look, it is not the memory, it is the recalling. If you have understood this, close your eyes and think about the medial compartment of your own thigh. Place your hand over the medial compartment. Try to recall which muscles are lying in this compartment. So, if you recall it, that adductor longus, brevis, adductor magnus, gracilis, these are the muscles of the medial compartment. Two other adductors, obturator externus and pectineus, are outside this compartment. So, I recall in my mind about the adductor longus and try to recall the diagram which I have seen. So, if I have an idea, I have understood the origin and proximal attachment and the distal attachment and its action, so I can recall it very easily. And if I have understood, I should be able to locate them on the cadaver, or I should be able to find it in the atlas, because I have the knowledge of its attachments and its action. This is the way the anatomy can be memorized. Without seeing the atlas, without seeing the muscle attachments, we cannot appreciate it. So that practice should be done by the students. Now we will discuss about the neurovascular bundle in the medial compartment. First we will discuss the vascular bundle. When we were discussing about the femoral artery in the femoral triangle, we know that femoral artery is a continuation of the external iliac artery coming from the abdomen, when the common iliac artery divides into external and internal iliac artery. Just at the beginning of the femoral artery is a big branch which arises on the lateral side of the femoral artery, and is the largest branch, and below the inguinal ligament, lateral side of the femoral artery, and it descends and it rotates medially and then descends in the interval between the adductor longus and brevis and lies on the adductor magnus, where it ends as a fourth perforating artery. So main artery is the profunda femoris artery, which is the largest one here. You will open the diagram, you can appreciate this profunda femoris artery. Its branches will be medial and lateral circumflex arteries and four perforating arteries. This is very important to understand the profunda femoris artery and to look at the diagrams which is showing. I will show the other diagrams onward. And the vein will be profunda femoris vein, which will receive the tributaries which correspond to the branches of the artery, and it will obviously drain into the femoral vein. Another artery, which is obturator artery, is a branch of internal iliac artery. So this is a branch of external iliac, femoral artery, which is external continuation of external iliac. Obturator artery is a branch of internal iliac artery. So it will be coming from the pelvic wall on the lateral pelvic wall with the obturator nerve, passes through the obturator foramina and divides in medial lateral branches, which are muscular, articular to the hip joint. So this artery, which runs on the lateral pelvic wall with the obturator nerve. So we will later on see its course with the obturator nerve. And the vein will be obturator vein, which will receive the tributaries according to the branches of the femoral obturator artery, which are medial and lateral branches, muscular and articular branches of the obturator artery. So here we are seeing femoral artery, its course, profunda femoris artery, and its course is branches. But here, now in this diagram, in my opinion, the student should draw this diagram and memorize this diagram so that it can be fully understood. Here, the common iliac, external iliac, common iliac dividing into internal iliac, external iliac. Here, the from the femoral artery, a big branch, profunda femoris artery, is originating, moving downward between adductor longus and brevis and on the adductor magnus. So here are the branches. So first branch is a lateral circumflex, then is a medial circumflex of femoral artery, and then are the four perforators, first, second, third, and fourth perforators. Perforators means they will perforate the muscle profunda, the adductor magnus, and they will anastomose with each other. These perforators are very important because they supply the big adductor magnus and also muscles on the posterior compartment of the thigh. And here are the anastomoses which are made. We will see later on the importance of this anastomosis. It is not the topic here, but during our study we can appreciate that this is a cruciate anastomosis here forming between the lateral and medial circumflex femoral arteries and a branch. If this is the internal iliac artery, and then is the branch of the internal, like the inferior gluteal artery, and then here is the branches from the inferior gluteal artery, and which is anastomosing here, and here is the superior gluteal artery, and from the interior branch here is the obturator artery which will originate from here. So this is the profunda femoris making the two anastomoses. We can recall, if we draw this diagram, we can very easily recall the two anastomoses, trochanteric and cruciate anastomosis. And the very important thing to understand here is that if this is external iliac, this is the internal iliac. So basically these two anastomoses are between the external iliac and the internal iliac artery. And the importance is that if it is blocked here, the femoral artery or the external artery blocked here, the blood supply to the lower limb can be re-established through these anastomoses through internal iliac artery. In this sense, they are very, very important. Alternative blood supply from the internal iliac artery. Now you can imagine the importance of these two anastomoses. And another diagram showing the two one. Here it is more simpler than the other one. So in my opinion, one should draw and label these diagrams, should practice these diagrams so that for the examination point of view, student will be able to draw this diagram in the paper and we can appreciate this. So in my opinion, these two diagrams should be practiced by the students. Okay, here is shown the arteries and the anastomosis. Now here is, we are saying that it is the internal iliac artery. Here it is anterior division and is the posterior division. From the interior division, here are the inferior gluteal artery, which we were seeing that they are anastomosing in the trochanteric and the cruciate. But here is another artery from the interior division moving towards the obturator membrane and entering into the obturator canal. This is the obturator membrane, and here you can see that they are entering into the obturator canal, and through this obturator canal it will move out of the pelvis. So this is the inner side of the pelvis, out of the pelvis into the medial compartment of the thigh. And here is another artery which is internal pudendal. Here you can appreciate its course to the pudendal canal and then also supplying the thigh. So obturator artery here is a branch of anterior internal iliac artery, anterior division of internal iliac, moving towards the obturator membrane and entering into the obturator canal. And obviously here, along with the obturator nerve, also will accompany this obturator artery. So obturator artery, branch of anterior division of internal iliac artery, enters the thigh by passing through the obturator canal and immediately divides into anterior and posterior branches. The two branches diverges, run on the outer aspect of obturator membrane along with margin of obturator foramina and covers the obturator externus muscle. So we can understand the branches and relations of the obturator artery. We are discussing it separately because this is the main artery of the medial compartment of the thigh and also supplying the hip joint. Is anterior and posterior divisions. Obturator nerve is the main nerve of the adductor compartment. Here we can locate, this is the lumbosacral plexus, lumbar plexus mainly, and here is the sacral plexus, lumbar plexus, sacral plexus. It is ventral division of the anterior primary rami of L2, L3, L4. So here is the anterior rami and here is the obturator nerve. L2, L3 and L4 anterior rami. They are uniting together and forming the obturator nerve. Course is in the abdominal medial margin of the psoas major, so it will run here in the medial margin of the, then it will enter into the obturator, and the pelvis, it will run on the lateral wall of the pelvis and enter into the obturator canal along with the obturator artery, and it will divide into two branches. So here we can appreciate the obturator nerve. Obturator nerve coming down on the lateral wall of the pelvis, reaching up to the obturator membrane covered by the obturator externus, and then it will come to the thigh, and it divides into anterior division and posterior division. Anterior division runs between the pectineus, under the cover of pectineus, then between the adductor longus and adductor brevis muscle, supplying all three muscles. The posterior division, a big one, it will passes through the obturator externus, then comes to lie over the adductor magnus, and here it is supplying the adductor magnus. And the anterior division is also supplying the gracilis. And you can appreciate here also that this pectineus is supplied by the anterior division and the obturator externus is supplied by the posterior division of obturator nerve. And here the obturator nerve is containing, posterior division is containing downward, and it will enter into the adductor canal, and then it will supply the genicular branches to the knee joint. So the anterior division and the posterior division, and anterior division, pectineus, gracilis, longus and brevis, and articular branches to the hip joint. The cutaneous branch to the sartorius, subsartorial plexus with the medial cutaneous nerve of the thigh and saphenous nerve. It also supplies the femoral artery. It's the anterior division. Posterior division, you see the posterior division, same diagram I have shown to you. Muscular branches, obturator externus, brevis, magnus, adductor part, and it will supply articular branch to the knee joint, and its vascular branch to the popliteal artery. Here is a complete course of the obturator nerve from the abdomen, lumbar plexus, ventral division of anterior, primary rami L2 and 3, 4, L2, 3 and 4, appears at the medial border of psoas major, and then it passes on the side of pelvis, accompanied with the obturator vessel to enter the obturator canal. Outside the canal, in the thigh, divides into two divisions, anterior and posterior. Anterior division in front of adductor brevis, posterior division behind the adductor brevis. So here is the obturator nerve. There is an accessory obturator nerve, and this is acquisitional branch. In some books says that in 30% of the cases this branch is present. Some says that 12%, but it's an accessory, not present in all one. Descends close to the medial side of the psoas major and behind the inguinal ligament, and it will give branches to the pectineus and hip joint. So this nerve can be damaged. So when it will be damaged, then it will cause the waddling gait, lateral leg, swinging, drag. Why? Because we are unable to cross the leg while sitting, and while walking we are unable to adduct. The adductors are paralyzed, so adduction will be impaired, and obviously the sensation on the medial side will be impaired. It can be caused by anterior dislocation of the hip joint or prostatectomia, or means carcinoma of the prostate. Here in the while it is passing through the obturator canal at the obturator membrane, and can be trapped at this side also. So we have obturator nerve entrapment syndrome, result from abdominal tumors, endometriosis, obturator hernia, and abdominal trauma or surgery, and pain along the medial side, along with the paralysis of the muscles on the medial side of the thigh. And neuropathy is also there. It's a pain, weakness of the adductor muscles. Hip will be unstable. That can be due to pelvic fractures, penetrative trauma, malignancies, hip arthroplasty, hernia, nerve entrapment syndrome, lithotomy position, pregnancy. This can cause. So diagnosis can be made by EMG and by CT scan, MRI or ultrasound. Anti-neuropathic drugs are given in these cases. So whenever there is obturator nerve injuries, the causes, muscles affected, motor loss, sensory loss is that. So we have discussed the medial compartment of the thigh, and along with that two adductor muscles, obturator externus and the pectineus also. We have seen during our discussion that it is the muscles we have seen. So we have seen that is the profunda femoris artery is the important artery. Along with that, the obturator artery. These two arteries are important. A blood supply of the medial compartment, and here we see how the profunda femoris taking part in the anastomosis, although it has nothing to do with the obturator artery, but this is for the purpose of learning. We are see, in my advice, these diagrams should be drawn by the students, especially this one and this one. These are very helpful in the exam purpose. And then we have obturator nerve, obturator nerve artery, obturator artery, and its course and passing through the obturator canal, how it enters, and then between the adductor longus and brevis. Obturator arteries, branches, and its course has been shown here. Then the obturator nerve, so and the clinicals of the obturator nerve. So inshallah, in the next lecture we will discuss about the posterior compartment, or first will be the gluteal region of the body, and we will see the muscles, neurovasculars of the gluteal region. Inshallah, we will discuss. Thank you. But lastly, before leaving the lecture, again my advice is that do not try to read the contents without looking at, without confirming it in the atlas or the diagram which is given, and also try to apply it on your own body by performing the actions of the muscles on your own body. Thanks a lot. Inshallah, we will meet in another lecture. Allah Hafiz.